And we have Dr. Keith Thurgood. He is our program director for the master's program in healthcare leadership and management. And Dr. Thurgood will go over with some important documents and stuff that he needs to discuss with you all for all the incoming students for spring 2024 semester. And I will provide some links, important links and documents in the chat while he's talking over. Okay. All right, Dr. Thurgood.
Okay, thanks. I'm gonna share my screen here. Well, first off, let me ask this. How many are registered for the fall 2024, or are you coming in the spring of 24?
Hi, I'm coming in for spring of 24.
Spring of 24, okay, cool, that's great.
I'm coming in for 2024 too.
Okay, all right. Sarah, how about you? If you're saying anything, you're on mute. Alicia, how about you? Spring, okay, thank you, Sarah. Got it.
The spring for me.
Okay, all right, cool, great. All right, well, let me share some documents with you here and talk a little bit about what we're trying to do in the program and why we think that's important. Probably some things you should know. So I'm going to start off with this chart right here. So here's what I've learned leading large organizations, multi-billion-dollar organizations, as the CEO or being a general in the United States Army and spending some time in the Middle East in combat. We all have to be learning organizations and learning people. Because as Alvin Toffler said, he's a futurist. He said, the illiterate of the 21st century will not be those who cannot read and write. It will be those who cannot learn, unlearn, and relearn. And this is important because in the world that we live in today, and healthcare is probably more acute than other industries, we as leaders in this industry have to be flexible and adaptable and willing to drive change where we can. So I'm going to share a couple of things with you about our program and what we're trying to accomplish. So one is, when you leave the program over the next 18 months or 24 months or however long it takes you to finish your degree, we want you to leave being a leader of character, competence, and commitment. Somebody that's courageous, who can make a difference in the healthcare space. Now, that means that it doesn't mean that you're going to be the expert on everything. But what it does mean is that when you leave and you're assigned to a healthcare, an IDN or a clinic, or you want to be involved in the healthcare space somewhere, maybe you're going to sell insurance. I want you to be able to think critically. I want you to be able to collaborate. I want you to be able to take a problem, develop courses of action, come up with recommendations, validate and stand behind those recommendations, and then be able to communicate that broadly to senior leaders. So some of your first jobs in healthcare space, they might be the captain of the United Way campaign. It may not have anything to do with healthcare, but I want you to be able to make a difference in whatever role you end up in. And so we want you to have a broad understanding of the healthcare and how it's delivered in the United States, understand how laws and policies impact what we do, understand the emerging technology, including things like AI, wearables, how will they impact us? And then, as I said earlier, I want you to be a skilled decision maker, critically analyze data. And all of these things are important because it will help you be a better person when you come into the healthcare space. So a couple of things that you need to know. Let me highlight these things in red. One, the curriculum is 9 core classes. Each of the core classes is 3 credit hours. And these 9 core classes make up the bulk of the program. In addition to the 9 core classes, you'll also have to take 3 elective classes, which are also 3 credit hours. So by the time you finish this, you'll have 36 credit hours, unless you are under the catalog, which you're not, but future students will also have to take a 10th core class and it's called our capstone practicum class. And this is the class where we bring everything together. There's some simulations that we go through. There's a bunch of case studies and group work that we go through. You've got to solve a bunch of problems, bringing everything that you've learned throughout the program together in this class. Now, here's the thing. We're gonna actually offer this class as an elective in the spring of 24, which probably won't be that helpful to you. It will start to be a mandatory core requirement, however, in help me, fall 24. Fall of 24. And so, but it won't be a mandatory requirement for you because you entered the degree under a different catalog. But if you're coming in the fall of 2024, you're going to be under the new catalog, and that capstone class will be a requirement for you. Point number 2 in the red box. We're transitioning the program to a competency-based program. And this competency-based program is tied to all of our curriculum. And I'll explain that more in a little bit later. The reason this is important is because it's just the competencies include some technical skills, but also include some leadership skills. Both are needed in today's industry. And then finally, about 6 or 7 months ago, we got word that we were CAMI accredited. A CAMI is an additional accreditation that graduate healthcare programs can earn above and beyond their normal university accreditation. So we've been working really hard on that for a long period of time. We finally got accredited, and in this accreditation, it allows our students, for example, to join some of the healthcare organizations for free, ACHE, MAGA, HIMSS, etc. So this is important. The last thing I'll call out that's really not in the red box is we're also developing what we call a center of excellence around our EMR, electronic medical records, or sometimes EHR, electronic healthcare records. And the system that most organizations use is Epic. And this is an elective class, but I'm calling it out because if you understand the core classes and Epic and how it works, this is a hands-on class, you will be very powerful in terms of your knowledge and your ability to influence outcomes wherever you land up. So those are some good things to know. A couple of other things for you to know. We've got some hybrid classes where you do some online and some in class. We have some pure in-class classes, and we have some online classes. For example, the undergraduate, the HMGT 6320, which is the core class, that is offered in 2 ways, one at the university and one online. And we teach them differently, and both are good. We also have something called our Elite Scholar and Leader Program for our top graduate students, which is about 10%, 10 graduate students or so. And for those students that are in this program, we spend a little bit more time with them in terms of coaching, teaching, mentoring. We focus on some research that we're doing, and they're first in line for some of our internships and fellowships, as well as the trips that we take. And we take at least one trip a year. This year we went to the Cleveland Clinic. Next year we'll be going to Washington, D.C. You can learn more about that from either Minal or Amy. So that's what we're trying to do. We want you to learn. We want you to do. We want you to become better. That's what we're trying to accomplish. Talked about the CAMI and the capstone class. And you probably know this if you're interested in healthcare already, or if you're in the industry. This is a fast-growing, fast-paced industry. It's the number 3 GDP growth in Texas. It's the 10th fastest growing amongst all industries, and the job growth rate's around 32% or so. So on the website, you can go in and you can find out things like the average salary of our graduates when they graduate. There's some links that we have that will allow you to look at how our curriculum ties to specific jobs in the industry, what the title of those jobs are, what the average healthcare salary is, and where those jobs are located. So go look at the website. There's a ton of stuff on there going forward. It's an exciting industry too. If you want to make a difference, this is where you want to be. I talked earlier about the competency program, so let me call out a couple of things here. I'm just going to talk about what I've highlighted in red. so you are aware of it. So we have in our competency model what we call a domain. So on the far left, you can see the domains. There's 5 of them. And then the second column over, these are the competencies. So we have 5 domains and 23 competencies. And in this example, you can see domain 1 is communication and relationship management. The competencies that are associated with that are build collaborative relationships, mediation and negotiation, build relationships with medical staff, and on and on and on. If you move across the right, there's some keywords, and then the middle column is how we measure it. And then if you move all the way to the right, you see the core curriculum. So this is a class that is tied to that specific competency and domain. And then there's supporting or elective curriculum that are tied to that same competency as well. And this is a general idea. There are classes that cover multiple domains and multiple competencies. And this is important because, again, we're moving towards a model that says we want you, when you leave the program, to be a leader of character, competence, commitment, and to be courageous when you leave. And this is our way of doing this. So why is this important and how we're going to measure this? So when you come into the program into the spring or into the fall, Minal will send you a link that will ask you to take part in a self-survey. So you're going to get the link, you click on it, and you're going to do a self-assessment on these domains and these competencies. And you're just going to rate yourself 1 to 5. And just be honest, it's just something to help you. It doesn't become part of your grade. You know, it's not a stick to beat people up with. It's a baseline document for you, so you know where you are on all these competencies. So that's one way that we're going to measure them. And oh, by the way, you're going to take a self-assessment once or twice, probably more, and you'll see the progress that you've made over the course of your degree, what your strengths are and what your weaknesses are. Additionally, number 2 is at the end of every term, every class will take a test, a portion of which will be part of your grade. It'll be 5 or 10 questions. And those questions are specifically designed question that is tied to a competency. That's the second way we're going to measure it. So a lot more objective. And then the third way is if you're on an internship or a fellowship, or you're working in the healthcare industry, we will ask your preceptor, your coach, your mentor, your supervisor to do the same self-assessment. And they'll get the same assessment that you'll get. They'll rate you 1 to 5. They'll send it to us. And again, we collect all of this data in a big aggregated data set in business intelligence. And we use it so that we can have a decent conversation with you about your strengths and your weaknesses. Again, not part of your grade. It's part of how we want you to develop as a leader inside the organization. Now, to help you do all this, we've developed a couple of things. Let me back up here. These links up here, by the way, this link takes you to our booklet. So we have a competency booklet. You can find all this on the website, by the way. You can go to the booklet and you can read about all of the domains and the competencies. What does it look like to be a successful collaborator? What are the derailers? So that's important. And then there's this link as well, which is this. We also have an online, self-paced, not for credit program that you can go through where we walk you through all 5 of the domains and all of the competencies in the domain. And this is kind of what it looks like. So you can see the big domains, communication, leadership, professionalism, etc., and just a suggested way to attack it. It's all self-paced, not for credit, but it helps you because in there we have things that we've added that will give you further understanding of that particular competency. This is an example of module number 1, domain number 1. So you can see the competencies, the 5 competencies, and then you can see the supporting curriculum, and then you can see the activities that we put together that will help you do that. There are articles, there are video clips, and on and on and on. Additionally, every once in a while, you'll get from either Minal or Amy or in our program an update on, hey, we think about this competency, and it might come with a little video or it might come with an explanation of what that is. And again, all in the spirit of helping you do that. So again, this is an example of module 1. It could be any module. again, no, you don't have to know this in detail, but just know that we have our program objectives, we have a course objective, we're tying it to domains, and this is how we measure it, on and on and on. So again, just an example. Now, this is where you should really pay attention if you haven't been paying attention. Again, 9 core classes, 27 core credit hours. The classes that you see right here on the left are the core classes that you must take to graduate. And you have to have a GPA, obviously, to graduate. And we'll help you through that if you need some tutoring. Some of these are important because they are either co-recs or prereqs for some of the classes. For example, HMGT 6320 is a prerequisite for almost every other class. So you have to make sure you take HMGT 6320 in your first semester. And then because it's a co-rec for some other classes, you can also take some of these other classes as well. So when you talk to the advising team, make sure that you understand the prerequisite or co-requisite requirements for the classes and lay your degree plan out in a way that makes sense for you. Point number 2 is some of these classes are not taught every term. An example of this is HMGT 6331, Healthcare Economics, towards the bottom. That class right now is only taught in the summer. Going forward, potentially in fall of 2024, we're going to teach it probably in the summer, if there's enough students, and in a long term, meaning in the fall or the spring. So when you talk to advising, make sure you have a good understanding of when these classes will be taught. Because what we don't want to have happen is for you to think you're going to graduate in May or December, only to find out you're missing a class that is only taught in the summer and you never took it. There are ways we can work around that, but it's complicated and it's hard. So just be aware of that. And then on the far right, you've got 9 hours of electives. We have all of these electives on the website. But if you are passionate about something and it's not one of our normal electives, then let's talk about it, because we can also do some elective substitutions. There's just a bunch of wickets that we have to go through, but that's possible as well. So don't think that it's just those electives. We have hundreds of electives that I think would be good substitutes for the course. And then finally, depending on your experience, you're most likely going to be required to take this MAS 6102. This is a professional development class, and it helps you understand the program. It helps you understand how to interview. It helps you understand how to write your resume or your CV, along with some other stuff, presentation skills, etc. So you may be able to opt out of that, but I doubt it. You can see. So those are the things around the degree plan. I'm going to leave time for questions, so don't worry about that. As I mentioned, I've got the capstone coming up as well. All of this is on the website, so this will be recorded, as Minal said. And by the way, it's all on the website again, so don't worry about it. You might decide you want to do a concentration. So we have 4 tracks: informatics, quality improvement, auditing, and supply chain management. These are the classes that are associated with a specific concentration. You may want to do that. You may not want to do it. If you do, again, think of your degree plan, the core classes, and then the elective classes that you need. Now, some of these are also core classes, so you can kill 2 birds with 1 stone, so to speak. The other thing for you to think about is our certificate program. So we have 3 certificates you can get: Lean Six Sigma Yellow Belt, Six Sigma Green, and Healthcare IT. Now, here's the thing. You have to declare your intent to get the certificate early in your degree plan. You cannot wait until you're a senior getting ready to graduate and then say, oh, I just realized I met all of the requirements for the Lean Six Sigma Lean Six Sigma Green Belt certificate. We can't go back and help you there. And Minal is the expert on this, so make sure you stay close to her on this. But some of the classes that you will take, for example, if you take all of these core classes, guess what? You qualify automatically for the Yellow Belt certificate, assuming you meet the grade, the GPA requirements, etc. Again, all of these are lined out on the website. Minal's done a great job at outlining the process. I'm bringing this out so that you're not surprised all of a sudden. You're like, oh, darn it, I wish I would have done this. So think about how you want to play that. Okay, let's see what else we have. Reach out to me, shoot me an email, Teams. I'm always happy to talk wherever I can. This is our program manager, and of course, Minal's on the call today. So let me pause there and see if there are any questions or comments that you have. Anything you're thinking about that might be worrying you.
I do have a question.
Yes.
So I am a fast track student. So you mentioning about the Lean Six Sigma one. I'm actually already took it during the summer of this year, but I'm
Yep.
not officially enrolled in the master since spring. So how can that process go?
Minal, do you know the answer to that? I'm not sure. It sounds like we should be able to work it out if you're in fast track, but I don't know.
Yeah, so the thing that goes with graduate certifications is that once you're enrolled in the program, you have to apply for certification, whatever you are interested in. And once you are in your graduating semester for certification, not your degree. I mean, if you are, say you are assuming yellow belt certification, then if that's a core class required for yellow belt, then if that's the last class that you're completing in yellow belt in say spring 2024, then you must apply for that certification. Let me know that you have applied for it, and I'll once you pass that class and once you graduated, once you meet all the requirements for the certification, I'll validate and make you eligible for graduation. So that's fine if you graduate, if you already completed the Lean Six Sigma class already, that is fine. You must have at least B or higher grade to achieve the certification. So if you're passed with B grade, then that stays on your record. And once you apply for the certification and once you're on your graduating semester for that certificate, just let me know. I'll validate way before in advance. Otherwise, once you pass that semester and after graduating, you are telling me that I need to apply for certification, that's not going to work.
So it sounds like all this could be worked out.
It could be
and
worked
you
out,
can get your
yes.
certificate.
That must
So just
count
make sure you-
towards your certification since you are not graduated from your degree or from your certification. So I think that score should count towards your certificate as long
Yeah.
as you have a B or a higher grade in that class.
Okay, thank
Okay.
you.
Yeah.
So you should be
Okay.
fine. Yeah.
Yeah. Okay. Anybody else?
I just wanted to ask, when should we apply to the certifications? Like, should we take the classes first and then our graduating semester apply, or should we do it earlier?
You can apply for the certification at the very beginning. Once you're starting in spring, you can apply that. I want to seek a certificate in yellow belt or green belt or healthcare IT certification. You can go ahead and apply for it. It's free for all the current UDD students. There is no application fee for it. And there are also some other waivers that goes with the current students. So yeah, it's all listed on the process that I put on the chat, and plus it's on the website as well. What are the application deadlines? So as long as you meet the application deadlines, you should be fine. But you need to let me or Dr. Thurgood or someone in the program know that we need to make you eligible. You are completing, you are in your graduating semester for that certificate. You are completing all the core classes required, all the required classes on that certificate in that semester. Say you started in spring, you're completing in fall 2024 with like all the 3 certifications or at least 2 certifications, then you need to tell me that please make me eligible for it. I'll go ahead and make you eligible for it.
Okay, thank you.
But make sure you all meet the requirements of B or a higher grade, and also all the required classes on it. That's all.
Okay, let's see who.
Most required
Alicia
classes
has
are
a-
like core classes, so you should be doing that simultaneously while you're taking your degree.
So Alicia has a question, and the question is there a chart or a spreadsheet? Yes, there is. And again, we can talk to you in a little bit more detail about this, and advising has the same information. On our website, you can click on, you can search and you can find a suggested degree program, and it lays out all of the classes. Now, I'm saying that a little bit tongue in cheek because some of the classes, again, you may not like them. You may want to do something specific with your, let's say, your electives. So use that as a guideline, and then let's work with advising to figure out a degree plan that works for you. But it'll at least give you a good framework of here's how somebody would normally do the degree.
I have a link for advising in case you need to talk to advising about your degree planning. They would go over with you all in detail. And there are
Yep.
different ways to contact advising, but either via help desk chat or via phone call or email, or you can walk in to on campus if you're on campus.
Yeah. Thank you, Mina, for telling everybody that. Yeah. So it's
Yes.
important. I think one of your next steps is, again, look through the website, get a general idea of the classes you want to take and what you think the sequence might be based on the frameworks that we already have or the plans or the examples. Think about your concentration electives that you might be interested in. And that can be part of the original game plan here. And then and then talk to advising about it and then lay it out, remembering the things we've talked about today. Not all classes are offered every single term. So make sure you kind of work through that. And again, we do have some flexibility where we can do some course substitutions. There's just a bunch of wickets that we have to go through to get it all approved, but it'll be great. We want you. Our job is to help you be successful here. And that's how I view my role as a program director. And for the classes that I teach, my job is to help you be successful. Now, you may have other classes, maybe your faculty doesn't share the same philosophy, but that's how we do it. We want you to make a difference. We want you to have some fun. We want you to get to know us. We want you to make a difference.
Yes, and I'm always available in office, 8 a.m. to 5 p.m. You can call me on Teams. You can walk into my office, except for Tuesdays. Tuesdays, I work remotely from home, so I'm not on campus, but Monday through Friday, like Monday, Wednesday, Thursday, and Friday, I'm on campus, 8 a.m. to 5 p.m.
Yeah, and I'm glad you brought that up, and all my classes are at night. So I'm not at the university every single day because I have a combination of asynchronous and synchronous classes. So they're all at night, but when I am on campus, sometimes I'm there in the day, depending on what's going on. But most of the time I'm there late in the afternoon. So if you need to get a hold of me, because you might be at work or at school, shoot me an email, text, call me on the phone. We'll figure out a time to meet that's convenient for both of us so that we can answer all your questions.
I have a question.
Yes.
How do we know which courses are like not provided during some semesters? When can we know that?
Yeah, you can talk to me now, and she can tell you that right now. And I'll tell you the two classes that are not offered every term right now. Let me come
6331 and 6332.
32. Yeah, thank you
Yeah.
very much.
But we are
Those
working
two-
on it. We might come that in fall because those are the only classes available in summer, but we might try for fall as well. For
Yeah,
next
that's
year.
right. So 6331 and 6032, they are only taught in the summer. Everything else we try to teach in both the spring and the fall. And sometimes, most of the time it works out. Sometimes it doesn't, because if there's not enough students to sign up for the class will be canceled. Now, that doesn't happen very often, but on occasion it does. Just be aware of that. So if you keep those two things, how do you pronounce your name? Do you go by, you go by Pretty?
Yeah.
Okay. So Pretty, so keep those in mind when you start to lay out your class, and you'll be fine.
Okay. So if nobody signs up for this course 6331 in summer, it will be cancelled. That's what you're saying?
Yes, it will be canceled. Now, we normally, I don't know, Minal, can you ever remember that class being canceled in the summer? I don't remember one being canceled recently.
No, because that's the only class. These two classes are only offered like once a year, only in one summer semester. So I think, and that's a requirement. So everyone must take that class. So it hasn't been canceled in past 1 year. We haven't seen anything canceled.
Yeah. However, to your point, let's say that it actually does get canceled and there's not an opportunity for you to take that class in the spring or the fall because you already have a full degree plan. Then what we would have to do is we would have to figure out a substitute for that class, which on the core classes is difficult, but not impossible. So again, I'm just telling you this because we want to provide as much flexibility as we can to help you complete your degree in the time frame that you're working against.
Okay, thank you.
You're welcome. Okay, our time is up. I look forward to meeting you. Call me, come and see Minal or Amy.
Yeah,
We want you to
feel
be
free to
successful.
contact us. We are here to help you, and welcome to the spring semester.
Everybody have a great day.
All right. Have a great day.
Thank you.
All right, bye.
Yeah.
Bye. Thank you.
Bye-bye.
Thanks, Minal.
You're welcome.